I work at a desk all day, staring at a computer, but between 3 to 5 p.m., I often get this tightening pain around my temples. I want to stay focused and not let it affect my performance. So recently, I've started taking Tylenol 3 to 4 times a week. Is it really safe to keep taking Tylenol so often?
Tylenol has acetaminophen, gentle on the stomach and safe when used right. But take too much, too often, or have the wrong conditions, and it can still be risky. The biggest concern with acetaminophen is potential liver damage. Here's why. Your liver processes and breaks down acetaminophen, changing it into a safe form that can be passed out in your urine. But if you take too much or drink alcohol along with it, your liver can get overwhelmed. This leads to the production of a dangerous substance called NAPQI. NAPQI is toxic. It can actually damage liver cells. That's why people with liver disease or weakened liver need to be especially careful.
Could you explain it a bit more in detail?
Sure. Under normal conditions, over 90% of acetaminophen is safely processed in your liver using methods like glucuronidation and sulfation. These turn it into water-soluble forms that are easily excreted. But about 5 to 10% takes a different path. It gets processed by an enzyme called CYP2E1. This creates the toxic compound NAPQI. Usually, your body uses a natural antioxidant called glutathione to detoxify NAPQI. But if you take too much acetaminophen, for example, over 4 grams in one day, then NAPQI builds up faster than your body can clear it. Once glutathione runs out, the leftover NAPQI directly attacks liver cells. That's how acetaminophen can cause liver injury.
I see. So that's why it's really important to follow the proper dosage and directions. And there's one more thing I've been wondering about. What if this headache is actually a sign of something more serious? That thought makes me a little worried.
That's a very important question. There are 2 main types of headaches: primary headaches, where the headache itself is the main problem. Secondary headaches, caused by another condition like an infection, high blood pressure, or even something serious like a brain bleed. Among primary headaches, the most common is tension-type headache. This is usually caused by long hours at a desk, poor posture, or stress. It feels like a tight band squeezing both sides of your head. Then there's migraine, which feels like a throbbing or pulsing pain. You may also become sensitive to light or sound and even feel nauseated. Sleep disruption or hormonal changes are common triggers. Even small things like dehydration, skipping meals, or caffeine withdrawal can lead to headaches. So the root cause of a headache is often more than it seems.
Do you think I should see a doctor?
Yes, I recommend seeing a doctor. Headaches that hit daily around 3 to 5 p.m. often suggest tension-type headache caused by tight shoulders, neck strain, and fatigue. It's no longer occasional, it's impacting your life. And frequent use of painkillers can backfire, leading to medication overuse headache. Getting a clear diagnosis now protects both your work and your future health.
You're right. Also, there's one more thing I've been wondering about. When I take Tylenol, the pain eases up in about an hour. Why does acetaminophen help relieve the pain so effectively?
We don't yet have a confirmed diagnosis, but based on your symptoms, let's assume for now that your headaches are caused by tension-type headache. Acetaminophen is a medicine that helps ease pain by stopping the brain from producing the chemicals that make us feel pain. It works by lowering the brain and nervous system's sensitivity to pain, so you don't feel it as strongly. That's also why it tends to work well when you have a fever or that achy, tired feeling in your body. Let's go into a bit more detail. Tylenol works by preventing the brain and spinal cord from producing the chemicals that make us feel intense pain. But first, why do headaches happen? If you spend hours working at a desk in the same position like you do, the muscles in your neck and shoulders start to get stiff. When that happens, blood flow in those muscles gets worse, and inflammatory substances like prostaglandins start to build up. Prostaglandins act like a signal to the nearby nerves, saying, "Hey, something's wrong here." This makes the nerves, especially the ones in your temples, connected to the trigeminal nerve, more sensitive to pain. Then that pain signal travels from your face and neck to your spinal cord, then to the trigeminal nucleus, and finally into the central part of your brain. There, an enzyme called COX-2 triggers the production of even more prostaglandins, which further increase your sensitivity to pain. So the more your body and brain react to these signals, the more clearly you begin to feel it as headache.
Can you explain the typical pattern of tension-type headaches?
To sum it up, tension-type headaches tend to follow this pattern. Number 1, muscle tightness. Number 2, Release of inflammatory substances. Number 3. Pain signals amplified in the brain. Then you feel the headache.
So how does acetaminophen help with tension-type headaches?
Even though we still don't fully understand everything, we do know that acetaminophen indirectly blocks an enzyme called COX, which is responsible for producing prostaglandins, the very substances that make you feel pain. Acetaminophen mainly works by reducing prostaglandin production in the brain, which helps tone down the pain.
Really? Does it work in the brain, not where the pain actually is?
That's a great question. In fact, acetaminophen is not very strong when it comes to reducing inflammation in the outer parts of the body. One reason is that acetaminophen doesn't work well in acidic environments. Let's go back to your situation. Sitting for hours with tense muscles in your shoulders, neck, or temples reduces blood flow, and inflammation builds up. This causes prostaglandins to be released, those same pain signal molecules. But in areas of inflammation, the pH tends to become slightly acidic. That's because of substances released by damaged cells and the body's own inflammatory response. And in acidic environments like that, acetaminophen can't do its job very well. Meanwhile, the brain and spinal cord are protected by the blood-brain barrier and blood-spinal barrier, which help maintain a stable, neutral pH. This means acetaminophen can get into these protected areas and work more effectively, reducing prostaglandin production right in the brain. By doing so, it helps prevent your nervous system from switching on that strong pain signal in the first place.
More recently, researchers have found that acetaminophen may actually strengthen the brain's natural ability to suppress pain.
Wait, does the brain actually have the power to reduce pain?
Yes. This system is called the descending pain inhibitory pathway, a built-in mechanism that sends pain-blocking signals from the brain down to the spinal cord. In fact, how much pain we feel and how intense it seems is greatly influenced by this system. Our bodies aren't just built to feel pain, we're also equipped with a system to prevent us from feeling too much pain.
So how does it work?
It starts with an area in the brain called the periaqueductal gray, located in the midbrain. This area sends out signals that travel down to a part of the brainstem known as the reticular formation and rostral ventromedial medulla, which includes nuclei like the raphe nucleus. Finally, the signal reaches the dorsal horn of the spinal cord, the exact entry point where pain signals from the body arrive. Through this pathway, the brain releases pain-relieving neurotransmitters such as serotonin and norepinephrine. These chemicals act directly in the spinal cord to block the incoming, ouch, signals, resulting in a reduced perception of pain.
And that's when acetaminophen helps out, right?
Exactly. It's believed that acetaminophen helps activate this descending inhibitory pathway. Specifically, it seems to enhance serotonin activity, which then helps gently calm down the transmission of pain signals in the spinal cord. Let me leave you with something exciting. After acetaminophen is broken down in your body, it turns into a powerful helper called AM404. This amazing compound works in two smart ways. It boosts your brain's calm and relaxed system by keeping more of a chemical called anandamide around. That switches on the CB1 receptor, bringing a sense of ease and comfort. It also quiets pain at the spinal level by gently blocking signals from pain, sensing nerves through a receptor called TRPV1. Yep, the one that chili peppers also trigger. So AM404 doesn't just mask pain, it helps your brain and spine turn down the volume on it. A double win for pain relief.
Here's the final check. What's the main mechanism of action of acetaminophen?
It reduces the production of prostaglandins in the brain and spinal cord, which helps lower pain and fever.
Thank you for watching all the way through. On this channel, I try to make medicine easy to understand and maybe even a little fun, because knowledge is one of the best ways to take care of yourself. If you found this helpful, a like or subscribe means so much. See you in the next video.
For quick, powerful reviews, this is the only channel. Don't forget to subscribe.